Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth, the Hidden Root of High Blood Pressure. And trust me, it's juicier than your cousin's peach cobbler. Did you know that 1 in 3 adults has high blood pressure, but most don't know what's actually causing it? We're talking about 116 million Americans walking around with a ticking time bomb in their chest, and they're blaming everything except the real culprits. Today we're going to uncover what's really jacking up your blood pressure, and I guarantee some of this will shock you more than your electric bill in August. Let's start with the sneakiest villain of them all, the hidden sodium trap. Now I bet you're thinking, Doc, I barely touch my salt shaker. Well, hold on to your hat because that salt shaker is about as guilty as a church mouse. Here's the kicker. 75% of our sodium comes from processed foods, not that innocent little shaker sitting on your kitchen table. Your favorite restaurant meal? It's packing 2 to 3 times your entire daily sodium limit in one sitting? Yep, entirely true. I can't make this stuff up. Even those so-called healthy foods are playing dirty tricks on you. That whole wheat bread you're so proud of eating, loaded with sodium, your morning cereal? Same story. It's like trying to lose weight while living in a candy factory. The deck is stacked against you from the start. But wait, there's more. Let's talk about something that's literally keeping you up at night and killing your heart during the day, the stress and sleep connection. When you're stressed out of your mind, your body starts pumping out cortisol like it's going out of style. This hormone is narrower than your patience when someone cuts you off in traffic, and it's squeezing your arteries the same way. Poor sleep is the evil twin in this dynamic duo. When you don't sleep well, your body gets confused about which hormones to release, and your blood pressure regulation goes haywire. Here's something that'll make you want to hit the pillow earlier tonight. Just one night of bad sleep can raise your blood pressure by 10 to 20 points the next day. If that doesn't make you prioritize your beauty sleep, maybe I should see you in the clinic. We need to talk. Now, let's get mathematical with the weight pressure formula. Every single extra pound you're carrying around adds 2 miles of blood vessels that your poor heart has to pump blood through. Think about that for a second. If you're 20 pounds overweight, that's 40 extra miles your heart is working overtime to service every single day. No wonder it's tired. What causes high blood pressure in the first place often stems from excess abdominal fat creating inflammation throughout your entire cardiovascular system. It's like having a small fire burning in your belly that's sending smoke signals to every blood vessel in your body. The good news? Losing just 5 to 10 pounds can significantly lower your numbers. Your heart doesn't need you to become a supermodel. It just needs you to lighten the load a little. Let me tell you about Sarah, a 45-year-old teacher who was convinced her blood pressure medication wasn't working. She was frustrated, scared, and ready to demand stronger pills. Then we played detective with her daily routine. Turns out her innocent-looking deli sandwich was packing 2,400 milligrams of sodium. That's more than most people should eat in an entire day. By switching to homemade lunches with fresh ingredients, she dropped her blood pressure 15 points in just 6 weeks. No new medications, no expensive procedures, just real food instead of processed poison. The bottom line is this: your blood pressure isn't rising because you're cursed or unlucky. It's responding to the environment you're creating with your daily choices. The hidden sodium in processed foods, the chronic stress you're marinating in, the poor sleep you're accepting as normal, and those extra pounds you keep promising to deal with next Monday. They're all working together like a perfectly coordinated team trying to sabotage your cardiovascular system. Here's your actionable takeaway that you can start today, right now, before you even finish listening to this show. Start reading those nutrition labels like your life depends on it, because frankly it does. Aim for under 2,300 milligrams of sodium daily. Your heart will start thanking you within weeks. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.